Sweltering heat warnings for psychiatric drug users. Prevent heat-related illness. Brace yourself. The scorching heat wave sweeping across the U.S. isn't just uncomfortable, it's downright dangerous, especially for those taking psychiatric medications. The Citizens Commission on Human Rights, CCHR, is sounding the alarm, warning that many psychiatric drugs can hinder the body's natural ability to regulate temperature, making users more susceptible to heat-related illnesses. Imagine this: it's a blistering summer day, and your body is struggling to cool down. For people taking certain psychiatric drugs, this struggle is intensified. These medications can interfere with the body's cooling mechanisms or dull the awareness of overheating signs. If not addressed promptly, this can lead to a range of heat-related issues, from mild heat cramps to severe heat exhaustion or even life-threatening heat stroke. But here's where it gets controversial. Antipsychotic drugs are particularly notorious for increasing the risk of heat-related illnesses. These drugs can reduce sweating, the body's natural cooling method, and diminish the urge to drink fluids or remove excess clothing. Even a brief exposure to extreme heat can cause a rapid rise in body temperature for those on antipsychotics. And this is the part most people miss: stimulant-type ADHD drugs can also raise body temperature and hinder the body's cooling abilities. This is especially concerning for active children during heat waves. Among antidepressants, newer SSRI and SNRI drugs can cause dehydration, exacerbating the risk of heat-related illnesses. Older tricyclic antidepressants decrease sweating and inhibit temperature regulation, making them particularly risky during summer heat waves. Patients need to be aware of the serious, even life-threatening medical emergencies that can occur during hot weather when using these psychiatric drugs, emphasizes Ngodik, president of the CCHR National Affairs Office. When body temperature rises to dangerous levels, immediate action is crucial to avoid potentially fatal damage. Research has shown that taking psychiatric drugs nearly doubles the risk of death during a heat wave. So, what can you do to stay safe? During the long, hot days of summer, doctors recommend staying well hydrated, avoiding overexertion, and wearing light, loose-fitting clothing. This advice is especially critical for those taking psychiatric drugs. About the Citizens Commission on Human Rights, founded in 1969 by members of the Church of Scientology and the late psychiatrist Thomas Szasz, MD. The CCHR aims to eradicate abuses and restore human rights and dignity to the field of mental health. Contact info. Name: Ngodik. Email: send email. Organization: Citizens Commission on Human Rights, National Affairs Office. Address: Washington, D.C. Website: http://www.cchrnational.org. Video URL: https://www.youtube.com/watch?v=8UFOUHES-ZY. Release ID: 891652215. If you spot any errors, inconsistencies, or have queries about the content of this press release, please inform us immediately by contacting Email Protected. Our reliable team will respond within 8 hours to rectify any issues or provide guidance on the removal process. Ensuring accurate and dependable information is our top priority. But here's a thought-provoking question: should psychiatric drug users be given more explicit warnings about the risks of heat-related illnesses? Or is it the responsibility of healthcare providers to monitor and advise their patients more closely during heat waves? Share your thoughts in the comments below. We'd love to hear your opinions and spark a meaningful discussion. Heat sensitivity and medications: what you need to know this summer. Beware, your summer medications could be a hidden health hazard. Are you unknowingly putting yourself at risk every time you step out into the summer heat? Millions of Americans might be doing exactly that without realizing the potential dangers lurking in their daily prescriptions. Heat sensitivity: the medication menace you never knew existed. Imagine feeling worse during scorching summer days, and the culprit? The very medications designed to help you. Sarah Dawson, a clinical pharmacy specialist at Centara Health, reveals a startling truth that could change how you approach your summer health routine. The shocking list of heat-sensitive medications. Prepare to be surprised. A wide range of common medications can dramatically increase your vulnerability to heat-related illnesses. We're talking about everyday prescriptions that millions rely on, including antidepressants like Prozac, acne treatments such as benzoyl peroxide, blood pressure medications, antihistamines, antibiotics, over-the-counter painkillers like ibuprofen. But here's where it gets controversial. Most people have no idea these medications can turn a sunny day into a potential health nightmare. The hidden risks, more than just discomfort. When medications interact with extreme heat, the consequences can be severe. We're not just talking about feeling a little uncomfortable. Dawson warns of serious risks including heat stroke, heat rash, fainting, dangerous dehydration, severe sunburns due to increased UV sensitivity. Protecting yourself, expert-recommended strategies. Don't panic, there are practical steps you can take to stay safe. 1. Stay hydrated, drink plenty of water, especially when taking heat-sensitive medications. 2. Cover up, use sunscreen with SPF 30 or higher, and wear protective clothing. 3. Keep cool, avoid prolonged exposure to direct sunlight and extreme temperatures. Medication storage, a critical consideration. And it's not just about your body, your medications are also at risk. Improper storage can degrade their effectiveness. Pro tips from the experts. Avoid leaving medications in hot cars or direct sunlight. For mail-order deliveries, have someone retrieve packages quickly. Consider a small cooler when carrying medications outdoors. Be extra cautious with temperature-sensitive items like insulin, inhalers, and EpiPens. The burning question, are you at risk? Take a moment to review your medications. If you're unsure about potential heat interactions, don't guess, consult your pharmacist or carefully read the accompanying literature. Controversial closing thought. Could your medications be silently compromising your summer health? We want to hear your experiences and insights. Remember, knowledge is your best defense against summer health risks. Stay informed, stay protected, and enjoy your summer safely.